across this apparatus in a very strange way. I went to Quebec City, I met my lawyer, and I was talking with him about the difficulty my wife had with her health following an accident she had about 16 years ago in the sea when we were in the Canary Islands. And he says to me, well, what's all this? He says, look, he says, is it painful? Is something to do with the back and all that? And I says, yes. So in a very short discussion, it took about 30 seconds, he mentioned this apparatus. He says he had one, it had done wonders for him, and then we left each other, and I came back to Montreal. And on the way back, I was with my wife, and I explained to her that there was something that seems to be miraculous. It could do maybe something for our back. So when we got back here, we contacted the office in Montreal, spoke with Dr. Gagnon, went to see him, and then had a very quick sample of what it could do. About an hour later, my wife says to me, she says, I feel less pain in my back. Oh, so I've heard that for the last 16 years. I've been hearing about back pains. So I says, yes, well, I says, good for you, So another hour went by, and she says, I have less pain again. So at the end of the afternoon, she says to me, she says, it's no joke. She says, I feel less pain. So about 2 weeks later, we bought the apparatus. I says, she says to me, if this can take away at least 10% of the pain that I feel, she says, it'll be worth it. So we bought it. But now, after we bought it, naturally, it took her maybe a couple of months before she really got down to having the benefits of it. You have to learn how to use it. Not too high, not too low, just the proper way. But now, from there, I will speak to you about my own experience. About 25 to 30 years ago, I had 2 whiplash accidents, 2 whiplash in the neck. When you're young and strong, you get the accident, you go through for maybe 2 or 3 weeks, you have the trauma, then after that the pain recedes, and then you forget about it. And as the years go by, you start to have a little bit of pain. And you learn to live with it because you go see the doctor and he says, oh, well, this is old age and you're getting old and the machine is wearing out, and give you all kinds of stories. So what I did, I says, my wife says, why don't you try it? So I took the rebones, put it in the neck, and being a big, healthy fellow, I says to myself, well, I should put it full blast. So I put it full blast. I felt the pain, naturally, more pain than before. I couldn't sleep on the left-hand side, by the way, for the last 10 years. I couldn't sleep on my left-hand side. I lay down on the left-hand side for maybe 30 seconds, and then I'd fall asleep on the right-hand side. But 2 weeks later, I put it down, somebody told me, put it down lower, it's too high. When you put it at full blast, it's too high. So I put it down at 2. 2 weeks later, the pain that I had here for the last 25, 30 years was gone. And then it was located in between the shoulder blades. And in the shoulder blades there, from another accident I had when I was doing gymnastics, I had a kind of a hump there in the back. Well, this hump took about maybe 2 months, and it just receded gradually. And I was stretching myself, taking my shower. I said to my wife, I said, is it my imagination, or is the hump here, I says, smaller than it used to be? She says, no, it's not your imagination, it is smaller. And now we've had this apparatus since last August. And I can tell you that personally, what it done for me, I never took a pill in my life, never even an aspirin, I don't know what it is. It took the pain away here. I had the lower back pains here because I had had an accident many years ago too, and it had located there, and once in a while you get, when the weather was not too right, you get a twinge. I don't feel that anymore. I never feel it even once, and I'm sure that it's due to this apparatus because it must have removed the inflammation that I had. The trapezius muscles here were so inflamed that my wife, who was very small and tiny, she couldn't even massage me because it was too sore. One day I told her, why don't you massage me? Maybe it'll help to the blood circulation. When she tried to touch me, it was so sore, I said, oh, leave me alone, don't touch me. After, it took maybe 2 months. Within a range of 2 months, the inflammation I had here for so many years, in these muscles here, was so sore Now I can grab them and I have a good grip. I can squeeze them. They are muscles. They're not sore like they used to be. This was inflammation that was there for many years, following the accidents that I had had. It has removed it. So when it says that it's anti-inflammatory, I believe it, because I've seen the results of it. So I could go on. I could tell you about things that I've seen. A 90-year-old woman, I was there when she arrived with her legs, and I saw what the varicose, the ulcer, I saw one. Within 7 days it had closed. I saw it with my own eyes. The woman came from Gaspé, and she was at a friend of mine's house who had an apparatus and who was treating her. And I happened to be there when he was giving her the treatment, just to help her. And then she went back to Gaspé. It took 7 days, and the wound was completely closed within 7 days. Only 10 minutes every day. That's all it took. And the leg became pink within 7 days. So when he mentioned 2 months, 3 months, it must have been a difficult case, because she had an open wound, and 7 days later it was closed, and it was pinkish. I saw another man, a friend of mine, for 30 years. He was wearing an apparatus here to listen, to hear, because he had a necrosis of his ear, and it never completely healed, so he couldn't hear anything. After using his apparatus, he removed the apparatus. After 30 years, he removed it, and now he hears me just like we are now. And I asked him, I says, look, I says, this is miraculous. He says, no, it has regenerated the tissue, which had been with necrosis, had gone bad. And it completely healed the eardrum. I saw this with my own eyes, so I can tell you other things that I've seen, but I think that's enough.